If you want to get rid of neck pain from a car accident, you need to see a specialist. Hi, I'm Dr. Jensley, a chiropractor and a herniated disc specialist. I've been serving the Houston community for the past 20 years. Today, we have one of our patients. She has serious car accident which causing herniated disc in her neck, and it's causing a lot of pain to the head, to the neck, and arm pain and numbness. Today I'm going to explain how we're going to treat her condition using our methods at Texas Spinal Care. First of all, we're going to heat up the neck to soften the muscle so that later on when we do the adjustment it can be very, very comfortable. So I'm going to lay down right here. So the patient going to lay down on the heat for about 10 minutes. During that 10 minutes, the heat going to soften the muscle spasm, the muscle tensions. So she's going to feel a lot of relief just from the heat alone. So the next thing we're going to do is we're going to do spinal manipulation. Because when she has a car accident, she has a lot of inflammation, and that will cause a lot of scar tissue to form. Scar tissues are like bubble gums. It's sticky. It makes the joint very, very stiff. So the adjustment is going to break up the scar tissue, help the joints to move, therefore reduce the pain. So I'm going to do spinal adjustment now. So I'm going to take this away. Spinal adjustment is a process of apply a very gentle force to the joint to move the joints and to break up the scar tissue. Very comfortable, very relaxing, and very therapeutic. So that's done with the adjustment. The next phase of herniated disc management is we do a very special procedure called spinal decompression. Okay, Paula, come over here please. Okay, this is spinal decompression procedure. Is designed to reduce the disc hernia. So let me explain what disc hernia is so you can understand what this machine will do. This is a spine. On the top view, this is the disc. The disc has two parts: the outer rings of ligaments and the inner nucleus. It's a soft jello material. It contains a lot of water in here. The yellow parts are the nerves. So the nerve impulses from the brain go down to the spinal cord, exit these spinal nerves, and it goes to the organs. Control the circulations to the organs so the organs can function. And also that nerve impulses control the function of that organ so that you can have normal function. So during a car accident, the whiplash, the force from the accident, tear the ligaments, causing this soft jello material to ooze out like this, create a mass. This mass now compresses the nerve, causing pain and numbness, as well as weakness in the extremity. So in order to relieve pain and reduce the risk of surgery, we need to make this mass go inside. So this is what this spinal decompression machine will do. So the machine harness to the back of the neck, and it's going to do like this. We apply a force, a very gentle force, the force is going to pull the neck and hold a minute. When we pull like this, it creates a vacuum in the disc. Therefore, suck in the water into the disc, then makes the mass, which we call the disc hernia, smaller. So it won't compress the nerve, therefore the pain will relieve. And then the machine will release halfway. Hold for 30 seconds and pull again. And it's going to repeat this whole process for about 20-30 minutes. So like you can see, it sucked in the water and it pushed out some, sucked in the water, push out some. It creates like a pump. It pumps oxygenated water into the disc, push out the toxins out of the disc. We do this for about 20-30 times. And then the disc hernia will become smaller over time. So that mass won't compress the nerve. The patient feel no more pain, no more weakness, no more numbness. And afterward, we're going to stabilize it with exercise and nutrition. And I will show you after this procedure. So far, she has the heat, the adjustment, the spinal decompression. This is our next part of the herniated disc management, is the neck exercise to strengthen the neck muscle and flexibility of the muscle to stabilize what we did with heat, adjustment, and decompression. So the patient going to move the neck backward, move all the way back. Relax, move all the way back, relax. This will make the neck in the back here very, very, very strong to protect the neck from any other injury. And the patient going to do this three sets of 6 reps, and then 3 sets of 10 reps, and then 3 sets of 15 reps every time she comes to the office for therapy. So another way that we can strengthen the neck is using nutrition. Nutrition consists of water, because we know that in the nucleus of the disc, it contains a lot of water. So the patient is advised to drink at least 3 to 5 cups of 12 ounces a day. Secondly, she needs to get some protein. We're going to put some protein powder into a blender. Let me show you one of the protein that we have here. So this is the a bottle of protein powder. We put this protein powder into a blender with apple, banana, berries. Make a delicious smoothie so that you can drink them every day. The protein going to make your muscle very strong, so that combined with the exercise, combined with our therapy, which was heat, adjustment, decompression, and exercise, and then nutrition, all work together synergistically to help the patients to relieve pain for a long time, to stabilize it, so that way the problem will not come back. And so the patient can go back to regular activities, and also reduce the risk of surgery, because herniated disc is the most common cause of neck surgery. And this is very risky, very expensive, and very dangerous. So we help you with this therapy to get well without surgery.